NREMT practice question number 4. You approach a patient sitting in a chair with their eyes closed. You ask the patient if they called 911. They open their eyes and say yes. Then they inform you that they have a headache and that it feels better when they close their eyes. You should consider the patient to be A. Intoxicated, B. Experiencing an ophthalmic migraine, C. Alert to verbal, or D. Alert. If you need more time to review this question, pause the video now. The answer will be revealed in 5, 4, 3, 2, 1. And the correct answer is D. The patient is alert. Now, if you got this question wrong and you answered C, alert to verbal, you're probably confused and maybe even upset or frustrated. If that's the case, make sure to stay for the explanation, as I will cover exactly why the correct answer is D, alert, instead of C, alert to verbal. But let's go over the wrong answers in the correct order. A, intoxicated, is wrong because there's nothing in the question that indicates the patient is intoxicated. There's no information about them having drank alcohol recently or consumed drugs, and you should never assume that somebody is intoxicated unless you have evidence to support that theory. This is because patients may appear to be intoxicated, but may actually have low blood sugar or have some other type of medical emergency causing some of their symptoms. B is wrong because there are no indications that the patient is experiencing an ophthalmic migraine. If you didn't already know this, ophthalmic migraines cause a person to see squiggly lines in the corner of their vision. This usually presents in both eyes, whether the eyes are open or closed. And there's nothing in the question that describes such symptoms occurring, so ophthalmic migraine doesn't make sense. C is wrong because the patient is not alert to verbal, as that would indicate that they only respond to verbal stimuli, do not open their eyes spontaneously, and have a decreased level of consciousness. One of the biggest mistakes EMS responders make when it comes to assessing somebody on the AVPU scale is that they remember that alert to verbal means that somebody opens their eyes in response to verbal stimuli, but they forget that it also means they immediately close their eyes once the verbal stimuli stops. Let me say that again. Alert to verbal means they will only open their eyes in response to verbal stimuli that is directed toward them, and as soon as the verbal stimuli stops, they then close their eyes again. As you see here, according to NCBI, the National Center for Biotechnology Information, verbal response is when the patient does not open their eyes spontaneously. The patient's eyes open only in response to verbal stimuli directed toward them. And once verbal stimuli is directed toward them, they then can react to verbal stimulus directly and in a meaningful way. However, once verbal stimuli is stopped, they will then close their eyes again until additional verbal stimuli is directed toward them. That's because they only open their eyes in response to verbal stimuli and are not spontaneously opening them. You need to remember that if somebody is alert to verbal, it means that their level of consciousness is decreased. And as you know, when we assess somebody on the AVPU scale, we are trying to determine if their level of consciousness has decreased from them being alert and opening their eyes spontaneously to them now only opening their eyes in response to verbal stimuli, or being alert to only painful stimuli, or just being completely unresponsive. If you are still confused, let me give you an example of what a question would look like if the answer was alert to verbal instead of alert. In this example, you now see the correct answer is C, alert to verbal. But the question is, you approach a male who appears to be sleeping in a chair. You ask them if they called 911, they open their eyes and mumble, and then they appear to fall back asleep. You should consider the patient to be, and again in this scenario, the answer would be alert to verbal. Because when you give the patient in this example verbal stimuli, they open their eyes, and as soon as the verbal stimuli stops, they then close their eyes again and appear to fall back asleep. Now let's get back to the question that was originally given to you. In that question, the patient opens their eyes when you give them verbal stimuli and says yes, but they then inform you that they have a headache and that it feels better when they close their eyes. This indicates that that person's eyes were closed not because they have a decreased level of consciousness, but because they have a headache and it made them feel better to close their eyes. Once the verbal stimuli was given to them, they then opened their eyes and their eyes remained open. And there's nothing in the question that indicates their eyes closed again or that they appear to suddenly fall back asleep, which means their eyes are now opening spontaneously and therefore they are alert. This question required that you use critical thinking to recognize the fact that this person, based off the information in the question, does not have a decreased level of consciousness. They are fully alert and their eyes were only closed because they have a headache. So again, the correct answer is D, they are alert. If you found value in this video, make sure to give it a like. And for more NREMT practice question videos just like this, make sure to visit and subscribe to our channel. If you're looking to pass the National Registry Cognitive Exam yourself, make sure to visit our website, howtonremt.com, to get your membership today. With your membership, you'll get lifetime access to a free practice app that has hundreds of questions that mirror those on the National Registry exam. 1 year of unlimited live group tutoring with an instructor who will teach you exactly how to pass the National Registry exam, access to our videos and content that will teach you everything you need to know to dominate and pass the exam, and of course your membership will be backed by our 100% guaranteed to pass or 100% money back guarantee policy. So again, make sure to visit howtonremt.com now to get your membership, and don't forget to use code DOMINATE at checkout.